Oh.
Any day now, this heartbreaker will be a big brother.
Is it going to be a brother or a sister?
Sister.
Greg and Jessica Cook waited 9 years for their first baby, Zane.
My whole goal was natural birth for that one. Found out last minute that it was going to be a C-section because he stayed breech. I was nervous about it because I didn't want to use medication.
For this baby,
You hear the heartbeat?
Jessica is still hoping for a natural birth, but if needed, she'll use a pain management method more than 100 years old.
We just found out that it's now available. I'm a dental assistant, so we use nitrous a lot in our office.
Nitrous oxide, more commonly known as laughing gas, was popular pain relief during the 60s, before epidurals or IV pain medication became common. And now it's making a comeback.
Every mom I've ever been around has loved it.
Dr. Kimberly Fortner delivers hundreds of babies a month. She explains women use nitrous in many different ways.
I've seen women who decide to do no medication and then only use it for pushing or for times when they're a little bit more anxious. Some women will use nitrous just to get their IV started. And I've seen women who are happy to have the option and then moved on to epidural.
Across the country, epidurals are still the most popular form of pain relief during labor, and they're also the most effective. Now, doctors say that nitrous is the middle ground between a natural birth and an epidural. It also puts women back in control, allowing them to choose how much medication they want and when they want it.
Well, this is the unit. It blends the oxygen and the nitrous equally and runs it through this. That sends it out to the patient, so she's in total control of it.
When mom needs relief, she lifts the mask to her mouth and breathes, even on a walk through the hall.
And they're so thankful for that opportunity.
And sometimes she'll laugh right through labor.
Do people get giggly?
Yes. Yes, they do. I think it surprises people, especially in early labor, how effective it is and how much euphoria it gives them because they don't expect to feel that way in labor.
Dr. Fortner points out feeling can be lost with epidurals or IV medication.
If you stop IV pain medication, the effect is residual for 30 minutes to 2 or 3 hours. And with an epidural, sort of a very similar thing.
But with nitrous, the euphoric effect lasts only minutes.
No, there's no effects on the neonate, and in fact, it doesn't suppress any of their APGAR scores. It doesn't change anything, and so that even if she takes a breath within her last few pushes, right before she delivers, by the time the baby's delivered, the effects have worn off.
Oh, look, there's the baby. See her face?
A quickly fading drug that helps create a long-lasting memory. On a day that, for the Cooks, will be full of surprises.
We were completely happy either way. You know, boys, girls, we're fine with either.
That was Brittany Bade reporting. You can imagine there are some caveats to this, mild side effects, dizziness, as well as some nausea. So bottom line, you need to talk to your doctor.